Hi, I'm Dr. Karthik Chandra Vallam, Chief Surgical Oncologist and Robotic and Laparoscopic Surgeon at Medicover Hospital, Visakhapatnam. November is Lung Cancer Awareness Month, and this being the second most common cancer in men in India, I take this opportunity to just enlighten you a little more about lung cancers. Lung cancers are unfortunately increasing in numbers because of the increase in number of smokers and also because of the rapid increase in air pollution levels. Some things we cannot change. We cannot change air pollution. We cannot change the place where we live sometimes. But how to detect lung cancer early? The most common symptom of lung cancer is cough. A cough which persists for more than 2 to 3 weeks, and even after we take basic medication, if it is persisting, we have to take it seriously. And also sometimes cough associated with bleeding, while that is the fall of blood in the sputum, is also an ominous symptom. And cough associated with breathlessness, cough associated with fever also can happen in lung cancer. See, these symptoms are very common. 9 out of the 10 times when we go to a doctor and they do simple tests, usually it will turn out to be not cancer. But 1 out of 10 times it might be cancer. And if we are able to detect this early, then we can treat the lung cancer in a very better way, very efficiently. Any cancer, once we diagnose it, we need to know whether it is in an early stage like stage 1 or is it a late stage like stage 4. We do certain tests like endobronchial ultrasound, which is an endoscopy based test, and then something like a whole body PET CT scan to confirm that it is cancer, and also to learn the stage at which the cancer is presenting. So if there is a very small tumor, 2 centimeter tumor in the periphery of the lung, it is mostly a stage 1 cancer. But if there is a large tumor with spread to the lymph nodes, or tumor spreading to the brain or liver or somewhere else, it is a stage 4 cancer. So once we get to know the stage of the cancer, then we need to decide what treatment we can give the patient. Now, the treatment depends on which stage it is presented at. Stage 1 and stage 2, we usually go for upfront surgery. We do surgery first, and if required, we might add some sort of chemotherapy after doing the surgery. In stage 3 cancer, some patients will go for surgery first and then chemo later, but some patients will go for chemo radiation, that is, radiation along with chemotherapy at the same time. In stage 4 cancer, usually it has spread, and the treatment is usually only chemotherapy, and with its latest modifications like targeted therapy and immunotherapy, which have evolved very rapidly in the last few years. As a surgical oncologist, I will speak a little bit more about the treatment in stages 1 and 2, where surgery is the treatment. Now, in surgery, what do we do? In surgery, in a standard procedure, we do what is called as a thoracotomy. We open the chest widely, just like in problems of the abdomen, where we make a laparotomy, that is a big cut in the abdomen, and remove the tumor or whatever it is. Similarly, we cut open the chest and spread the ribs and see where the tumor is, and remove the tumor along with its with a margin and the lymph nodes nearby. Now, this is a very painful procedure, though this is the standard procedure. This is a bit painful because opening the chest is a painful procedure, and patients are not very comfortable breathing after this procedure. However, I am a specialist in what is called as the VATS procedure. VATS is a minimally invasive procedure that is called expanded as video assisted thoracoscopic surgery. In this surgery, with only very small incisions, 1 centimeter incisions, maybe 3 to 4 centimeter incisions, we are able to do the same surgery with the help of a endoscopic camera, which enables us to view it in a very magnified way with high precision. We are able to remove the tumor and the lymph nodes without compromising on the cancer outcomes. This helps the patient in quick recovery. The patient is able to walk on the next day and able to get discharged in 2 to 3 days. As compared to the standard thoracotomy, the patient takes 1 week to 10 days to get recovered and get discharged, and there is a long-term pain. Have you heard of anybody getting an open appendix removal or an open gallbladder removal? No, right? Everybody gets it done laparoscopically. Similarly, we do this surgery with the VATS, that is similar to laparoscopic surgery in the abdomen. So that patients recover fast. And this is a very advanced technique which is adopted only in very few centers in the world and in India. And we are able to offer the same services to our patients. Thank you.